Good morning, everyone. I'm a bit excited. Please forgive me. So, therefore, I'll be reading out what I'm going to be telling you, so I would like to apologize for that from the outset. This very nice environment attended by worthy scientists, Dr. Mercer's speech to present him is in fact a memorable event. I wish it could have been more delightful for me. I wish it was not me who was standing here at this podium at this moment, because this session was in fact going to be moderated by Professor Esat Göktepe, but he passed away 3 days ago, very unexpectedly, so I'll be replacing him today. Of course, I feel the responsibility on my shoulders, and I'd like to share with you my feelings. I'm sure many of you knew Professor Esat Göktepe very well. In fact, there are those among us who have known him long before I have come to know him. So therefore, I will not be telling you his life story. I will be telling you what he would have told you were he here today. My purpose in doing this is not trying to replace him. As far as I've observed and seen his profession, his patients, his practices, his thoughts, his principles, I would like to share these with you for all of us to understand the kind of physician he had been. If he were here, he would say to us, always the patient's benefit comes first. No intervention that does not benefit the patient can have a place in treatment, and you can never decide not in favor of the patient. You have to feel the patient that you work with him. It's as important as the treatment that you're prescribing. If he were here, he would have said, please keep your medical records regularly. Even years later, you may need those records. A treatment that you have applied, sometimes you may need years before you see its effect on a person, especially when you work with resistant patients. The treatments that you apply, you may always receive different responses to it, so always keep this in mind. If Esat Bey were here, he would have said, patients, especially schizophrenic patients, one of the most important reasons in stigmatizing them is to believe that they will never get well. All psychiatric disorders, especially schizophrenia, are treatable diseases. They can be treated medically. You have to believe this in your heart, and you have to be able to tell this to your colleagues and especially to your patients. If Esat Bey were here, he would have said, the medication that you're going to be using, please try to find the lowest effective dosage so that patients will not have to deal with unnecessary side effects. For the patient, knowing that you're trying to protect him from side effects is very important. A patient, a disease, is part of a whole. Physical functions, mental functions, they all complement one another, and they're equally important. And he would have said, were he here, the most important factor that will determine the outcome of your treatment is the physician-patient relation you establish with your patient, which is based on trust. If this relationship is strong enough, you don't have to be afraid of resistant patients. These principles may sometimes be a word or a behavior. As his colleagues, we have always perceived these to be as such. These are part of his professional philosophy. He believed his principles, he applied those to the T, and he did his best for young colleagues to adopt these philosophies and practices. Be sure that he still had a lot to tell us, but I'm sure Esat Bey in fact didn't like to talk too much, and I will be respectful of this behavior of his, this attitude of his, so therefore I conclude